Welcome to the Pain Throughout Organ Systems lecture series, and we will get started with this part. It'll be in several parts. Let's start with our objectives. The objectives for this week's topics are listed here. Notice that the first two objectives are repeated from the first week and italicized. That's because I made a mistake when making the syllabus and put them in both the first and second weeks, but we'll cover them in this week. As you can see from this list, we'll learn a lot about pain receptors and their function, and then we'll go into various manifestations of pain throughout the different organ systems. But also notice that we are addressing the pain found in the regions of the body, which will involve many organ systems at once. We do this because this is how real patients present to the medical provider. They have pain in specific areas. It's our job to figure out the rest. Before we get rolling with all the fun stuff in this course, I think you should be familiar with some general terms that we use daily in medicine. First, a medical symptom is a departure from normal function or feeling, which is noticed by a patient, indicating the presence of disease or abnormality. A symptom. Departure from normal function or feeling, which is noticed by a patient, indicating the presence of disease or abnormality. A symptom is subjective, observed by the patient, and cannot be measured directly. Like my stomach hurts is a symptom. A medical sign is an indication of some medical fact or characteristic that may be detected by a physician during a physical exam. Signs may have no meaning to the patient and may even go unnoticed, but may be meaningful and significant to the healthcare provider in assisting the diagnosis of medical conditions responsible for the patient's symptom. An example of a sign might be spoon nails. That would indicate to the healthcare provider that the patient might have iron deficiency anemia. Okay, so a medical sign, objective indication of some medical fact or characteristic detected by a physician. Okay, there's the spoon nails. A differential diagnosis, that's what that's supposed to say. Sorry, I didn't bury that picture. A differential diagnosis, sometimes abbreviated DDX or either big DDX or little DDX, DD or D/DX, or even delta delta, is a systematic diagnostic method used to identify the presence of a disease state where multiple alternatives are possible. The method is essentially a process of elimination, or at least of obtaining information that shrinks the probabilities of candidate diseases. We'll almost always have a differential diagnosis of 3 separate medical conditions to consider. Get used to that. This practice not only helps us catch some less obvious diseases in real life, but it also lends itself well to multiple choice exams. Okay, the last little tidbit that I want to share with you before we get too far into the course is how to assess pain. What do you ask? During the process of acquiring a patient's history as a medical provider, you should ask the following questions in order to assess pain. Intensity. How would you rate your pain on a scale from 1 to 10, for example? Location. Where is the pain? Onset and pattern. When did it start? Was it sudden or develop over time? Is it continuous or intermittent? Extension or radiation? Does the pain move to other areas? Duration. How long does the pain last? Character or quality. Descriptions such as sharp, dull, shooting, ache, etc. Precipitating, aggravating, and alleviating factors. What starts the pain? What makes it worse? What makes it better? And associated manifestations. Anorexia, nausea, restlessness, insomnia. You'll see a lot of things that work with it. Effects on activities of daily living, like sleep, appetite, concentration, work, school, interpersonal relationships, marital relations, sex, hormone activities, driving, walking, leisure activities, emotional state, just about anything. Okay, so knowing the answers to these questions will get you a long way in figuring out the patient's problem. I'm not going to test you on these in class, but these are some pretty common factors that will be listed in our case studies that we make throughout the course. Our intent is to help you get comfortable with these questions, so when you get to your professional medical program, you can ask these questions naturally and give your patients comfort and confidence in you. Okay? So, when a patient comes in with chest pain, your differential diagnosis, DDX, could include anything from somatic pain or pain coming from the skin and the chest to visceral pain originated from internal organs like the heart or lungs, from muscles, or even from cartilage or bones. In other words, we need to know a lot more information to make a diagnosis, because we can't assume that all chest pain is from a heart attack. So now we have the same situation, but now the pain is in the abdomen. We need to consider a stomach ache, of course, but we also have the appendix in the lower right part of the abdomen, the spleen in the upper left part, our intestines, both large and small, and a few different muscles are there too. Can you think of any other organs in the abdominal cavity? Okay, so why do we have pain anyway? You know what, let me stop right here because I don't want these to go too long. This is already 6 minutes into it, so we'll pick up pain and the purpose of pain on the next video.